Hi everyone. So welcome to today's 6 p.m. talk, which is going to be on a really interesting topic about functional medicine and if functional medicine can help mental health, anxiety and depression more specifically. So just before we'll have my guest who will be coming up soon, hopefully today. Dr. Vanessa Wong, who's a psychiatrist and functional medicine doctor based in Hong Kong. So every week, every Wednesday at 6 p.m., I talk about various topics related to mental health. This is part of simply the objective is to raise awareness, to break the stigma around this topic. And just to create, to be able to answer any questions that people have, but also to talk about what these different conditions might be, what the different problems are, just to give a bit more insight into different aspects of topics as well as solutions. But most important is that everything that is mentioned here are based on my own clinical opinion over the 20 years of practice that I have in the field of mental health. So it doesn't replace any kind of treatment or assessment that you may need yourself. So if for whatever reason you are unsure of what's going on, or if you feel unwell, it's really important to consult with a specialist in your area. Now, of course, if you have any questions you'd like to ask, or if you'd like to get some a referral somewhere, I might be able to help if you were to send me a message. Otherwise, it's if you, for whatever reason you're feeling unwell, it's important just to get support from someone who is in your area. So again, if during this talk today, this conversation I'm going to be having with Dr. Vanessa, that you have any comments, anything you'd like to know, just please comment, and then we'll be answering as we go along. So I'm just waiting for Dr. Vanessa to join in. Great. And here, I'm really excited about this talk. I think there's quite a few people who are also interested about functional medicine. Hi.
Hi.
Hi, Vanessa.
Hi, how is everyone?
Hi. All right. So nice to have you.
Thank you.
Good. Yeah. How's everything going?
Good. Yeah.
It's okay.
Same as usual. COVID.
Same as same as usual. So in Hong Kong, like you're completely locked in, or is it kind of moving around?
It's pretty good. Yeah, we're moving around. Things are starting to open up, and we're getting vaccination on the way. So hopefully, it will start to turn into a little bit better. Yeah.
Yeah, that would be good. I think the last time we connected was perhaps over one of your podcasts.
Yes, that's right.
This was a few months ago. That was very nice. Yeah.
Thanks for having me on your channel.
Yeah. You're welcome. So today is an interesting talk. I think that there's a lot of people who don't really know what functional medicine is. And so I thought it would be a great way to actually introduce it. And of course, there's some of our listeners who do know about functional medicine. So I think this is just like part of raising awareness on this subject, and with specific reference to mental health and also to anxiety and depression.
Yeah.
I think that there's just one little example I'd like to give out of really many examples that I've had over the years of practice. Is I remember this person who came to see me, and she was suffering from a panic attack. And she wasn't responding to the medication that was prescribed to her, as like Xanax or some other anxiolytic, and she wasn't really responding to that. And then suddenly she stopped the medication, and then it turned out that she had a deficiency in B12. And as soon as she took the B12, then suddenly her panic attacks stopped. I mean, this is not to say that everybody who has a panic attack is B12 deficient. But of course, that was really super insightful, and I think that's perhaps one of the aspects of functional medicine, is that it's really about looking at the roots of problems as opposed to just treating symptoms.
Yeah.
So yeah, I'd like to. Yeah, I think it would be great to hear a little bit more about what you have to say.
Well,
since you're the expert.
Well, maybe I should give a little introduction. So
Yes,
it kind of
please go ahead.
plays into the context. So
Correct.
I'm conventionally trained as a psychiatrist. So in psychiatry, we generally go with DSM-5 or ICD-10. So you check off a bunch of symptoms, you find the best fit, and then you get given a diagnosis, and based on a bunch of studies, these diagnoses would be treated with this medication. If you translate that into diabetes or hypertension, it's like the doctor saying, well, you kind of look like you may have diabetes. You told me you've had these symptoms, so here's a drug, And what about checking my blood sugar? What about checking my blood pressure? Do you need to do a scan? Do you need to, do any kind of testing? It's like, no, we're good.
Okay.
And so with psychiatry, it's very difficult because there is no definitive testing. It's all based on symptoms thus far. And yes, we have made progress into brain imaging and so on, but the diagnostic criteria itself does not require any testing, any confirmation. And so what I found difficult is, how can so many people have different reasons for being depressed or anxious all be treated with the same drug? And that's why it doesn't work all the time. If I gave someone diabetic a diabetes medication, and metformin, for example, their blood sugar will go down. If I gave it to you, Jeremy, your blood sugar will go down. It's just that you're not, high in blood sugar, so I will push it down the other end. So with functional medicine, I mean, the term itself probably evolved over time. I think it started off with, Linus Pauling, and then there was orthomolecular, and then people kind of use different words over time. But the word functional, for me, it stands for, what's functioning in your body. And when there is a dysfunction, we need to look at it. And how this plays into mental health is that what I found is, great example you gave is the B12. So I would have people come to me and they've been vegans, right? And they're kind of questioning why a psychiatrist is asking about their diet, their sleep patterns, how they pee, how they poo. And they're like, why are you asking me all these questions? I'm like, because it's relevant, right? Because you don't become vegan and have problems in 3 months, generally. It may be like something you've, over time, depleted certain minerals and vitamins, or you've been under a lot of chronic stress, and over time that causes changes in your hormones and your metabolism, and it starts to suppress your thyroid, and you start emotional eating, and that pushes up your insulin, which is another hormone. Or your lifestyle matters, right? Your sleep matters, your exercise levels matter. And so if you look at these things, you can see a correlation between these dysfunctions and mental health. And so what we're trying to do in functional medicine is, we're trying to figure out the root cause of maybe sometimes why people may have depression and anxiety. And there are patients out there which I see who has really good lifestyles, the vitamins, minerals are all dialed in, they have a good diet, they exercise and so on, and they genuinely have either certain genetics or certain ways that their experiences have wired them differently, that they respond to stressful situations with depression or anxiety. And there may be medications that could help them, but it's not a blanket solution. And I find what I want to do in mental health is be able to separate people who can be treated or helped with non-medication methods before we resort to medications. I'm not anti-medication. I've seen medications work really well, but it should always be in conjunction with lifestyle and functional optimization.
Yes, I think that what you're saying is really, really important. And for some reason, you kind of wonder why not all medical practitioners, healthcare practitioners, psychiatrists won't actually look at, the kind of the person as a whole, as opposed to just the symptoms and just to treat the symptoms themselves. When it makes complete sense when you think about it, that basically we're just not a head, let's say in psychiatry, like we're not the head, and the brain works separately from the rest of the body, it's everything is connected. So why would we not just kind of nearly instinctively just kind of work in that direction and really assess inflammation levels, deficiencies in the body? Is it a question of there's not enough time, people need like fast solutions or fast results, or is it a question of something else?
There are so many answers to that question.
Yeah, it's
But let's
huge.
start off with what you said. There
Yeah.
are patients who come and they're not at a stage where they're willing to commit to making those changes. And yeah, they may need medications to help them at that point. And yeah, I'm fine. I can meet you where you are. I think fundamentally also it's to do with the way doctors are conventionally trained, right? Because we're really good at fixing acute things. You know, you break a
Uh-huh.
bone, you go to a doctor,
Yeah.
it gets fixed. We don't need to talk about your lifestyle before we fix your bone. But mental health is something that generally develops over time. It's, you know, sometimes I ask patients, why do you think people still get depressed and anxious? If evolution was, you know, perfect, it would have weeded out schizophrenia and bipolar and personality issues and so on.
Yeah.
But it's
Yeah.
because there is an evolutionary advantage to having diversity in a community. It's just that when it comes to the individual, it becomes either a strength or a weakness. And so I don't really see them as a disease per se. I'm just seeing them as on a spectrum that we need all these people. And with depression and anxiety, it's a way that you respond to stress in general. And when it's chronic stress, we're not good with dealing with chronic stress. Acute stress, great, you know, run away from the tiger, stay alive.
Yeah.
But in our current everyday environment, it's just chronic stress, and at some point your body isn't able to cope with it. But the way that doctors are trained, like I said earlier, is recognize a symptom, put a label on it. There's a medication that goes with that label, and insurance will take billable codes and reimburse these diagnoses and pay for your medication. And pharmaceutical companies make money off selling you medications. And so the whole system kind of plays into this paradigm where it's really hard to shift out of it. It's hard to get people in the depth of their depression and anxiety to really look at fundamental changes they can do, which are not sexy, which are not billable, and don't make many money for all those, you know, big pharma and big insurance, and you know, and the government's policies don't necessarily reflect what they want to do. I mean, I understand they want to promote health, but they've kind of sucked into this disease model where they are playing catch up to fix a fundamentally, you know, an imperfect system.
Yeah. Yeah. And it's not to say, like you were saying at the beginning, that the medication is not necessarily helpful. But obviously, sometimes it's like it's prescribed too fast without really looking at the person as a whole, which is the problem. And I guess that if people are informed, like for example, we're just having this conversation, and there's going to be viewers, people are going to be looking at this. Some people who have never heard of functional medicine, you know. So I think this can actually be spreading some awareness. And you know, I think that when people know that there's maybe other solutions, that they can go and look for it. They can ask maybe the doctors that they're actually seeing, you know, are you trained in functional medicine, you know, as a practitioner? At least if I'm in mental health, and of course that's the topic of what we're talking about. So let's say they're going to go see a psychiatrist. Might be a useful thing. I think that there's more and more psychiatrists who also have kind of added this functional medicine element to their profession. Is this something that you are seeing more and more so in your experience, and I don't know, in Hong Kong or in other parts of the world?
Yeah, I think there is a movement to shift towards incorporating more functional medicine or integrative medicine, holistic, complementary alternatives. There's so many names to describe these things.
Yes.
But there are people gathering around. So the American College of Psychiatrists, they do have a complementary and alternative kind of faction, like a subspecialty
Yes.
that you can join.
Yes. Mm-hmm.
I'm in a Facebook group with functional medicine psychiatrists. There are conferences. So IFM did a conference I think 2 years ago, because COVID was a bit of a write-off, on mental health. And there's IMMH, so Integrative Mental Health conferences. There's an ISNPR, which is an integrative, like a nutritional kind of take on mental health as well. That's run by Julia Routledge from New Zealand, and Bonnie Kaplan. So it is happening. I think it's just spreading the word and driving it from the grassroots is educating the public to ask for these things. You know, if enough
Yes.
people ask for it, the doctors are like, well, what is this? You know, then they get interested to learn.
Yes. Yeah. And it's true that functional medicine is an evidence kind of follows a systematic kind of evidence-based approach, right? I mean, it used to have this connotation of being some kind of alternative um, medicine, a kind of approach, but that's kind of changed.
I think it depends on what lens you look at it. I
Okay.
found that over time, I have incorporated a lot of functional medicine, I guess you say skills or knowledge.
Hmm.
But I would say treating a person as a whole, you really need to have a whole toolkit. Because if you, even with functional medicine, I do see sometimes where people say, oh, we've tested you, we've run a lot of expensive testing on you, and these are the problems, so take all these supplements. So it's called green medicine, right?
Hmm.
You're prescribing a lot of natural things, but you're not really still getting to the root of the problem. And
Yes.
ultimately, the root of the problem could just be how to breathe properly, how to meditate, how to sleep better, uh, find your emotional connections in your tribe, and all these things that don't really need to come out of a bottle as well. So I think for me, I am using functional medicine, but in order for it to be widespread, not everybody has access or the means to have really expensive testing.
Yes.
And I've done the testing and I've learned from it, and it's helped me recognize patterns. So
Hmm.
I have a better educated guess on what that patient may look like. And yeah,
Mm.
it's always good to have data, right? So if someone is willing
Yes.
to do the test and I have a lot of information in front of me, obviously that would be very helpful.
Mm.
But again, if people are looking at functional medicine tests, be mindful of what you're testing and the methodology behind it and whether it is backed by science. So, for example, recently a test came out, a paper came out, it was published saying that
Article.
stool, yeah, stool
Mm.
testing really has no bearing on the person's gut microbiome,
Mm.
which, you know,
Uh-huh.
if you're just treating test results, that's kind of contradictory because you're like, oh, you're lacking in this this probiotic or this organism. Take this and take that. It's people like to make things simple. People like to have a reductionist approach because it's easy, it's clear cut, it's straightforward. But life is often not that way.
Yes,
So if you're
exactly.
looking for a functional medicine practitioner, find one that is open-minded and also incorporates other aspects, and they're not so dogmatic in the sense that you have to do these tests, then you have to treat it in one specific protocol. You know,
Yeah.
there needs to be a degree of flexibility, I think, when you go to a functional medicine practitioner, that it needs to be tailored to you.
Yeah, absolutely. It has to be personalized.
Yeah.
And again, it's coming back to that same thing that when the person doesn't know the questions that they can ask, or what they don't know the information, you know, they don't know, they don't have the information, then they won't necessarily know the options. So they'll just follow whatever practitioner they see and their methodology. And if that practitioner happens to have a reductionist approach, well, that's how it's just simply going to be, right? Um,
Well, my
so yeah.
argument would be that they've done this protocol for enough people that it has worked for a significant number of them. That's why they continue to use those protocols. I'm not saying those protocols are bad. You do need a foundation and a framework to
Mm,
work off from. But to know that it doesn't work
mm,
for 100% of the people, and when you do come across
mm,
someone that comes to a doctor and say, your protocol is not working, they have the flexibility to tweak it.
yeah. Mm, mm. I think there's a. I think can be also interesting to look at when you're getting the results from the testing, and what do you see most often? Do you see more often in your practice like some sort of inflammation?
Yeah, so the easiest thing that people can access is blood testing because you can go to any
Yes.
GP and most labs would run a lot of standard markers. So a panel that I would normally do would include, you know, the complete blood counts, liver and kidney functions, thyroid function, iron profiles, inflammation markers, maybe some hormones, maybe some nutritional markers like vitamin D, B12, magnesium, zinc, copper. So if you look at that sort of report, you're also trying to look at it from a more functional lens. So a lot of doctors would just look at them and go, oh, there's a, it's highlighted in red, or there's a star next to it, or there's an H meaning high or an L meaning low. And if it's a marker that they're not familiar with, they just take the lab reference as a guide, and sometimes they even ignore it because it's like, oh, it's not that bad, But with a functional lens, you're looking at an optimal range, which is often narrower than what the lab ranges are. Because the lab ranges are generally based on a population of people who go for testing. And the people who go for testing are generally sick. Right, so you're comparing yourself against a relatively sick population. They draw a curve of it, cut off the 5% on the ends and go, that's our range. So you want to have a doctor that can also read these markers and say, hey, you're not sick yet, you're not diabetic, or you're not too bad off this, but you're getting there, or there may be a dysfunction here. And there are different tools, and now there are softwares, and you can train yourself to read in these functional markers. But you really want to pick things up earlier, right? It's more about prevention and more about picking up signs rather than trying to play catch up when you already have a disease. So blood markers are really useful to get insights into, I can look at, some of the markers on a complete blood count and say, well, you probably have a folate or a B12 deficiency there, which is why these numbers are slightly off. Or you may have some iron deficiency, or there's a lot of inflammation markers you can look for. They may not necessarily tell you why these markers are off, but it gives you a clue as to where to look next. And a good functional medicine doctor should be like a detective. They should really turn over every stone and figure out why. And I think for me, why I'm attracted to functional medicine is because my favorite word is why. As opposed to taking things at face value, I want to really understand the reason behind it. So it's a journey that you should take with your doctor and explore any possible underlying reasons. And there can be surprises, and not everything falls neatly into boxes. But at the same time, if you don't have that curiosity and you just slap on medications, I feel you're sometimes doing a disservice for the patient in front of you.
Of course, so it's really a look at the question why is really looking at the root cause. It's looking at how there's this domino effect and where is it starting, so that basically you can actually really get to the root bottom physiologically to create this betterness in the person's life, right? So let's say you have someone who comes in with a mood disorder or depression or severe depression. I mean, how would you work with such a person who comes to see you?
Well, no, it's really important to take a good history, because the history itself can give you so many clues as to where to look next. So a comprehensive history should not only include all the symptoms that you've had, it should also include, previous episodes, what treatments you've had, what worked, what didn't work. And then I would go down the diet, nutrition, sleep hygiene, exercise and movement, stress management, and then hormones. For men it could be libido, hair loss, muscle bulk. For women it's very clearly menstruation, menopausal symptoms, different estrogen dominance, for example, like PMS or cysts and fibroids and that sort of things. And then trying to gauge, is their energy level probably related to their cortisol level, for example? Are they eating a diet that may be high in sugar and therefore they're getting these insulin roller coaster rides? Does their diet indicate any kind of nutritional deficiency? Do they have any family history? So, for example, someone in the family could have a gallbladder problem, and they could have like a bile duct problem, or someone had a cholecystectomy, for example, their gallbladder removed, that to me actually points towards a choline deficiency. And if this person isn't eating a diet that is choline, or they have some methylation problems, and it's
Yes.
you know, if they have a SNP in their PEMT enzyme, so you kind of like snowball into all these things. And in my head, I'm juggling, you know, how many things is this gallbladder problem potentially going to, you know, spread into. And when you touch on things like methylation and choline, you're like, well, look, 40% of your methylation goes into making choline, and we could test your SNP, or just eat eggs. You know, eat if you're vegetarian or vegan, get some soy lecithin, see how you feel, and then you kind of work backwards into giving them suggestions that may play into these roles. Another one I like to use is, you know, if someone is estrogen dominant, but they're also really rigid, or they're over worrying, I start to look at COMT SNPs. Which is an enzyme that helps you degrade and metabolize dopamine and estrogen. And a lot of the times these symptoms come hand in hand. And so when you ask about family history, yeah, there are fibroid cysts, endometriosis, cancers of, you know, female hormone-sensitive tissues. And then you think, well, this enzyme works better with magnesium and SAMe, so we'll improve your methylation, take some magnesium supplements. It's really hard to get enough magnesium from the diet. And if they respond to that, the patient's happy, I'm happy, nobody needed to have, you know, expensive testing, and no medication was involved.
So it's really following like a step-by-step approach, really testing all the different alternatives, like natural alternatives, I suppose, before basically going to other type of medications if everything else hasn't worked. I mean, looking at not only the nutritional aspect, but maybe the behavioral aspect, like exercises, like what do you do? Do you go walking every day? Do you do some kind of stretching? Do you practice mindfulness? And I think that's a really important part of I guess the holistic approach, right? Of the integrative approach of also functional medicine really looks at that, right? It's like things like meditation.
Yeah. So another example would be if someone had a panic attack, like your client. So you look at nutrition aspects. Is it a B12 deficiency? Is it a thyroid problem? Is it an iron problem, etc.? Then you start to look at, well, what is a panic attack? It is an excess of adrenaline and cortisol push, right? So that's why you get all the physical symptoms of an adrenaline rush. What's triggering it? Could it actually be something like a mold problem, which I've seen as well? Could it be that they're sensitive to allergens that their body is responding to with a stress response? A lot of the times it is a mental stress, right? So something is triggering them. If it isn't essentially an uncued panic attack, then you're thinking, well, is the limbic system, which is responsible in our brain for your fear, your emotional response to threats, is it overactive? Right? So if your limbic system and your amygdala is overactive, why is that? Is there something traumatic in their past? Have they been wired a certain way? Have they been practicing this loop of fear and intense anxiety that it's no longer needs an input? It just kind of goes away. It goes off on its own tangent. So what can we do to reduce limbic overactivation? Meditation. Right? Lots of things that improves and reduces this limbic overdrive. And you're trying to now work with neuroplasticity. So what can also improve neuroplasticity? Well, it's practice. The neurons that fire together, wire together. But it's also being in nature, right? Having a dog and petting the dog, having emotional connections with people you love, doing specific programs that are designed for limbic overactivation. And so you're kind of trying to come up with these tools that a patient could use. And a lot of the times you could give them 5 or 6 options, but they don't stick. Right? Because different things work for different people. So maybe you have to throw a few things at the wall and see what sticks, or you kind of have to work with their personality, like what they latch onto, what they believe in. You need to now understand their belief systems. If they're like, no, meditation's too woo for me, get them to do something else.
Yeah.
Or if they're kind of more intuitive, then you can get them to do other things that tap into that inner resource that they have.
Mm, mm. Like I often hear other people who have discovered functional medicine and who are struggling with anxiety and depression, and then they were on medication and a cocktail of medication, and then suddenly, they stopped it, and they looked at the way that they were eating and then their lifestyle, because they were very passive, they were not really doing much, but then once they started making these adjustments, not only in terms of the food, perhaps even in terms of the supplements, but they were starting to exercise, they were starting to practice meditation, discovering all of these different activities for the first time, they noticed incredible improvements in their life. And also psychotherapy, because obviously they also had traumas to work on, but then they were able to work on all of this together. And in fact, the medication that they had been prescribed for years was not going to say unnecessary, but basically it never really allowed them to really heal or to work on the problem that really was about making these very specific small adjustments. Maybe difficult. I'm not going to say small as it is so easy to change a habit, but just being committed that, I'm going to heal myself just by following all these different other methods, as opposed to just passively, because they've been used to that, passively just taking the medication that I was just prescribed and you just wait for something to happen, but yet nothing was happening. I've seen a lot of people like that.
Yeah, and I understand if you're in the depth of your woes and depression and anxiety, and you're completely paralyzed by it, it is hard to make those changes. And if medication is the boost you need to kind of restart the program and give you just enough energy to start doing these things, it's not a bad idea. But there should always be an exit strategy. The plan should not be stay on the medication for the rest of your life. It should be a tool that you can use and say, hey, you know what? Try this medication. If it helps you do other things and now start making these changes, you will feel better because you've made those changes. And at some point, you'd no longer need the medication. And we should have a plan to come off these medications if possible. What I see is some people do go on the medications, but they don't make any of these changes. So now they need the medication to prop them up. And so I always bear at the back of my mind how to have this extra strategy. And then I find the appropriate time to talk about this throughout the treatment process with patients and say, hey, how do you feel? Do you feel the medication is working? Do you feel strong enough? Do we want to try reducing it? And yes, there's a lot of nuances, and I'm not saying that you should all go off your medications because it's something that no longer serves your purpose. You should discuss it with your doctor. I'm not your doctor.
Exactly.
But this is something that needs to be brought up and discussed. Whatever the outcome is very individual. You may choose to stay on the medication. Some people, every time they come off their medication, despite all the changes they've made, they still get depressed or anxious. And then for them, it is the lesser evil to stay on a low dose of medication and continue to have a good quality of life. That's a very personal choice. And I would support that choice if we had an informed discussion around it.
Yes, that's the key thing, actually. I mean, there are some people who are struggling with some form of inflammatory issue like eczema or food allergies, and then at some point they get this depression, and they never really even correlate the how the two can actually combine, as a and the connection between this long-standing inflammatory issue and then suddenly my mood condition that happens. Obviously, there's a lot of a lot of factors.
Yeah. And people don't make these correlations between the mind and the body. So, for example, if you're anxious, you may get gut symptoms. Like you said, if you have eczema, that's a sign of inflammation, and you feel worse mentally as well. So a recent example I could give is a teenager came to me with essentially prodromal symptoms of psychosis. So prodromal symptoms is you're not fully schizophrenic yet, or you're not fully diagnosed with a psychotic disorder, but you're showing some signs that you're progressing that way. And we discussed it, and the parents really didn't want him on medication. So we looked at I didn't think I even did blood tests on it. I'm like, you know what? Let's just work with this. You've got eczema and psoriasis. You've got all these signs that tell me that you have these certain genetic vulnerabilities or deficiencies, and it's a best guesstimate without the testing. But we started with just a few supplements, maybe like 2 or 3, and getting him to change little lifestyle things. And as his mental state improved, so did his psoriasis and eczema. And I'm like, you know what? That's a good gauge for you. If your psoriasis flares up, your mental health is also going to start acting up as well. Exactly. But the parents were amazed that, he no longer has dry patches. He's no longer scratching himself all the time. And I'm like, well, how's his mental health? And it's like, well, it's actually a lot better. I mean, not 100%. And that's down to whether is it your personality? Is it something...
The genes, maybe
it's genetic, whatever it is. You don't need to be perfect. You just need to be able to function and have a good quality of life. Like, I can accept that everyone has their eccentricities, and there may be 5% of symptoms that's residual, but it's not bothering them, right?
Yes.
And if that's something that you can live with and you can manage and you can get on top of it, and you're learning to recognize your own patterns. I have bipolar patients who don't need to be on medications. They just find lifestyle ways of managing it.
Yes.
So
I've seen this as well. Also, with some people with bipolar do much better with a lifestyle and just looking at their foods as opposed to the medication, whilst others do quite well with the medication.
Yeah. And I think part of psychotherapy is not just about treating the disease. It's about self-exploration. It's about learning how to be a better version of yourself and learning to understand yourself. And so I would encourage everyone to do some psychotherapy at some point, because it's about being a better version and learning to optimize, right? Because sometimes
that's a key word.
Sometimes you have blind spots, and having someone show you where those blind spots are will help you improve on them.
Yes, absolutely. And to heal. In the end, we all want to live, like you said, a better quality of life, and to optimize in the best way one can. Vanessa, I don't know if there's one more thing and something you'd like to share as maybe as the last word, or something, a takeaway for people out there who probably have just heard for the first time about functional medicine, and maybe that's going to get them start questioning. Oh, maybe I didn't think about that. Maybe I should. So something you'd like to say about that for people who are anxious and depressed, maybe?
I think for me, what's really important is to know and believe that your body and your mind is working for you and not against you. And you have the capacity to heal if you give it the right space and you give it the right conditions. So it's your job to figure it out, and the body will do its job for you.
That's wonderful. I wouldn't have said it any better. So on this note, we're just going to stop for today.
Thank you.
It was really lovely to have you, and hopefully we'll do this again.
Connect again
another time. Yeah. And if anybody has any questions, then obviously we can always answer you. So again,
my handle is Ananta Wellbeing. So if you need to find me
Wellbeing.
Yeah.
So you can, in any case, people will be able to access the link directly through the Instagram.
Thank you so much.
And I hope this was really helpful for everyone. And if you have any questions or anything, just don't hesitate to let us know. And thank you for comments and for sharing and following. 6 p.m. by time. Till then, have a nice evening, have a nice morning, have a nice day, wherever you are. Okay.
Thank you. Bye.
Bye, Vanessa. See you. Take care. Bye.